minutes. It'll be about another 5 minutes while Centennial reboots all of the systems so that we can get the meeting recorded and broadcast. So thank you for your patience. All right, Brian, are you back on as well? And was DOT able to make it back on?
I am here representing DOT with the presentation.
Great.
Bradshaw.
Thank you much, Tyler.
Okay.
For those online and in the audience, are we ready?
We are good.
All right.
Yeah.
Well, I'm glad that happened right before the meeting as opposed to in the middle of it. That would have been much more awkward. So thank you to Sarah and Centennial staff for getting us back online. I will go ahead and call to order the regularly scheduled meeting of Tuesday, December 12th, 2023. Please join me for a flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The Assembly of the City and Borough of Sitka would like to respectfully acknowledge the traditional First People of Sitka. With gratitude, we proceed on Lincoln Army. Sarah, roll call, please.
Mayor Eisenbeis,
Present.
Mr. Mosier,
Here.
Mr. Pike,
Here.
Mr. Yestad,
Here.
Ms. Carlson,
Here.
Mr. Saline,
Here.
and Mr. Christensen is absent this evening.
Great team. Great, thank you. Any correspondence or agenda changes this evening? No ceremonial matters. That'll bring us to special reports. We have two scheduled special reports this evening, starting with Search, a home health care update. Please, Doctor.
Is it okay for me to bring another chair?
You know, backup is always appreciated on your part, I'm sure, so.
There, can you hear me okay? Thank you. Okay, so I'm Dr. Elliot Burrell, citizen of Sitka, Chief Medical Officer for Search, and thank you for inviting me to come and give an update about home-based care. Okay, is that better? Okay. Let's see if I can. Run your computer. So in the past, there's been a freestanding home health department. It's had an independent administration, independent quality assessment and quality improvement. The requirements of providing care within that context meant that we had a staff of 8 employees, professional employees to do that. We inherited that program as part of the asset purchase agreement with Sitka Community Hospital and operated it for 3.5 years. During that time, we had multiple surveys from Center for Medicare Services, which is called CMS, and also from Joint Commission, which is an organization that ensures that our services are compliant with Medicare rules. And we've maintained a Joint Commission accreditation in that context and also for all of the other services that we provide. The services that were provided in that home health setting are listed there, and you can see they're quite extensive, including individualized care plans, personal care, wound care, education for patients, including training and teaching for tracheostomies, colostomies, and ileostomies, as well as end-of-life support in collaboration with Braveheart volunteers, as well as Center for Community and SAIL and Pioneer. This is some representative data from 2021, 2022, with respect to the visits that we had in the home health department. You can see physical therapy, skilled nursing visits, which are provided by a registered nurse, occupational therapy visits, the overall census, which is the total number of patients, and then deaths, which run between 0 and 2 a month generally. So in summary, the average demand for services is about 80 nursing care visits a month, 100 physical therapy visits per month, 50 occupational therapy visits per month. This year we made an adjustment to the way that we staff and provide that care. So we continue to provide the same services. We have dedicated nursing staff which are based in the clinic. We have dedicated physical therapists, occupational therapists, and speech language pathologists, which are also based in the Mountainside Rehabilitation Clinic. And we've adjusted staffing levels to be consistent with the demand for services. So demand for services generally for licensed nursing care is about, on average, 20 visits a week. And for physical therapy, about 25, and occupational therapy, maybe 12. So a staff of 8 professional staff is it's a really very heavily staffed approach to providing that care. So we've adjusted that by providing that care within the clinic down to 4 staff. So 1 registered nurse, 2 physical therapists, and occupational therapists. These are the services that we continue to provide to patients who need care in their home. And you can see that all of the same services that were provided previously in home health continue to be provided by our staff in home-based care. The home-based care that we're providing right now is compliant with and consistent with regulations from the Center for Medicare Services. So those regulations apply to all of the services that are delivered in the home, as well as to all of the other services we provide. We are Joint Commission accredited in all search programs in all locations, with the exception of long-term care, which is directly accredited through CMS. That's a difference in regulations. The care that we provide in the home-based care is covered by Medicare and is billed directly to Medicare. Medicare services reimburse outpatient care in rehabilitation or in skilled nursing at 80%. So that means there's a 20% copay. That 20% copay for those services is covered by coinsurance. So the vast majority of the patients that we serve has insurance in addition to Medicare. So something like Aetna or Blue Cross Blue Shield that cover that copay. For people who do not have secondary insurance, we have a sliding fee schedule. We have a sliding fee schedule which is available to all patients in all locations and for every service that we provide. So somebody who is financially unable to pay for their care we assist them to access the sliding fee schedule. That's not just true with home care, that's true with everything we do. We maintain collaborative relationships with the Pioneer Home, with Braveheart Volunteers, for Center for Community, and with Southeast Alaskans for Independent Living. So we've had those relationships pre-existing, we continue with those relationships. We provide home-based care services within the Pioneer Home to our patients that are residing there. We work with Braveheart Volunteers, which is a fabulous organization. Very proud to say that I was one of the people who founded that organization about 20 years ago. I served on their board for a number of years. And they are essential in terms of the fabric of care that we provide to people at the end of life. Center for Community is an organization that assists with non-licensed care. So if somebody needs like a home attendant, Center for Community is really the organization that helps us to be able to provide a non-licensed care attendant or CNA. And then Southeast Alaskans for Independent Living is an organization that assists with equipment, things like a shower chair or maybe a ramp in a house. So in summary, Search is committed to the health care of all persons in Sitka. We're committed to the health care of all persons that live in all 27 communities that we serve. Search is committed to the care of patients who are homebound in Sitka. Search home-based care provides all of the same services that were provided in the past by home health. These include social services, skilled, licensed nursing care, physical therapy, occupational therapy, and speech-language pathology. Home-based care is provided by skilled, trained, licensed professional staff, and it's CMS compliant. And home-based care staffing in this setting is commensurate with the demand for services. I did provide to you a one-page cheat sheet that is the information that we provide to patients regarding reimbursement for these services. I also would like to ask your indulgence and also respond to some additional questions that I've received from the community. So one of those questions is, what is Search's definition of home health service? So our definition is providing licensed professional care within the home to patients that are homebound, or unable to provide, or unable to leave their homes, and that we provide that at a level of staffing that's consistent with the demand within the community, so that it's sustainable in the future. How many staff, specifically RNs, administrative, were employed by the now closed home health department? How many dedicated staff are presently employed for home services? So as I explained previously, there were 8. Now there are 4. Does Search still have its same as before closing the home health department home care accreditation? As I mentioned, all the services that we provide are accredited, are compliant with Medicare regulations. The program does not have the context or the existence of a home health agency. So a home health agency is a dedication, is a designation within Medicare that is has specific requirements for administration and maintenance of records and other regulations, and that is really the reason that our staffing in that context was so high. So, having 8 staff in order to perform care for about 20 visits a week. So that's the reason for the change. And like all businesses, we have to adjust staffing to reflect the demand for services. I think anybody who's in business understands that. What values were driving the decision to close home health, and what vision of healthcare was driving this decision? The values that are expressed in our change is the value of maintaining sustainable healthcare, the value of providing care that is proportional to the demand within the community. There's lots of things that we would like to be able to provide. It'd be great if we could provide dialysis. It'd be great if we could do neurosurgery. There's just not enough demand for those services to justify staffing in that manner. We adjust staffing all the time. We've been increasing our staffing in behavioral health to reflect the fact that there's a tremendous demand in this community for behavioral health that's not met. We've more than doubled our staff in behavioral health in the last 2 years. We have adjusted upwards our staffing in substance use disorder treatment. We've more than doubled the size of that program to reflect the demand for those services. We have added a clinic to treat opioid use disorder. The reason for that is there's demand for those services. We have added a large number of specialists here at Sitka in order to meet the demand for specialty care close to home. So adjusting our staffing to reflect the demands within the community is really a pretty straightforward and understandable act within any business. Considering that home health services are regulated by the state and federal government in order to qualify for Medicare coverage, who will pay for home care services rendered by Surge when those services are no longer regulated? Well, the services that we're providing are compliant with Medicare regulations and are reimbursed by Medicare, and most of the patients that we serve are Medicare qualified. So that's where the payments are received. And then there's, as I mentioned earlier, about a 20% copay that's covered by insurance. Has a very specific nursing experience and expertise provided by the staff of home health been lost? And the answer to that is no. The services that are being provided right now in the home to patients are being provided by the same staff that were providing services in the past. Is Surge planning to provide palliative care as we face end-of-life healthcare challenges in Sitka? Is Surge planning to take another look at creating a Medicare-funded hospice facility in Sitka? The answer to that is we have looked very carefully at the possibility of providing a hospice facility in Sitka. I wish that we could. I wish that it existed. There is not a volume of patients that need that service that would be able to support the really tremendous amount of work and staff work in order to maintain a Medicare style hospice. That does not mean that we don't provide care for people at the end of life. It just means that it takes it's a more complex fabric that has to be woven in order to support those people. So It means that our staff provide the skilled nursing care, and it means that our organization, Braveheart Volunteers, support the patient and the family with their emotional and spiritual needs. It means that Center for Community supports that patient with a home care attendant. One of the things about the old home health services designation is that it's actually has some pretty tight requirements in terms of which patients qualify for those services. And the thing about the home-based services that we provide now through our outpatient clinics is that they those restrictions don't apply. So what we're seeing is actually an ability to provide an increased variety of services to people that otherwise wouldn't be served in the previous home health context. So I asked Bill Spivey, who is our search-wide director for rehabilitation clinics, to join us and talk a little bit about that, as well as Cody Skilling, who is our regional director here at Sitka for outpatient services.
Absolutely, thank you. I'm Bill Spivey. I'm a Sitka resident of about 20 years or so, and I have been a physical therapist, and now I'm, as Dr. Brule mentions, the rehabilitation services director for the consortium, and still very connected to the care that our teams provide across the consortium. Here in Sitka, the opportunity to provide home-based care for me and for my teams is actually, I have been excited about that opportunity because it's allowed my teams to do things that historically we were not able to do. There are services for pediatric patients. There are services for postpartum moms who cannot get into and bring their families with them to the clinic that we can go to the home and see. There is a growing group of physical therapists and occupational therapists within our national organization that are defining services that we can provide at end of life that previously we would not have typically provided in a home health setting. And so we are currently involved in those activities as well. So, and beyond the physical therapists that were specifically dedicated to our home health agency, now my entire rehab staff has gone through the training and is prepared so that if I have a patient who I'm seeing in the clinic on a regular basis that for one reason or another can't make it to the clinic for appointments, I can go to their homes and see them now so they don't lose track of the progress they've been making. So for me, it's an exciting opportunity.
Absolutely. Thank you for having us this evening. Cody Skilling, I've been here about 5 years in Sitka, and speaking for primary care, we're very excited to have the service line within, embedded within our clinic. There's a real touch within our providers, working with our nurses directly to provide these services, and it helps to have that in the clinic. And so, we're excited to create redundancy in training and staff to help make sure that we're continuing these services within primary care.
And there's some services that we've been able to provide now that we weren't able to provide previously. Maybe you can mention a few of those.
Yeah, absolutely. We've got a great opportunity to provide, immunizations is one great example for patients that wouldn't normally come to the clinic to get immunization, as well as lab draws, to where we can kind of same day go out there and take care of that, within a regular outpatient visit.
Thanks. What is the real reason behind the canceling of home health? Is it because Medicare does not cover the full charges, so it isn't cost effective? The home health department or agency no longer exists, but care of patients within the home has continued. It has not stopped. It didn't stop. Everyone in this community who requires that care that we're aware of is receiving it, and is continuing to receive it from licensed professionals in a setting that's compliant with Medicare regulations. Will Search provide any CNA services for personal care? The answer to that is no. We haven't done that in the past, and it's really not part of a home health program. Those services are arranged through Center for Community. What services exactly are available today, such as labs, wound care, medication management, case management, all of those services are available. Are social services available to assist patients that can't afford copays? The answer is yes. We have financial advisors and people that are available to assist folks in accessing the sliding fee scale. Is Search afraid that Sitka elders will tend to want to move away because they can't afford Search's home-based services? The answer to that is no. We're not concerned about that. We're working to increase the availability of care for people in their later years. We've been expanding our long-term care facility, and we're committed to continuing to provide care in the home to anybody who needs it. I guess one of the questions that people have is, why wouldn't Search choose to show up at a public meeting to discuss this, or why wouldn't we choose to work with the community in other settings? The answer really has to do with our commitment to process at the time of the asset purchase agreement. So what was set up at that time was something called the Sitka Community Health Council, which has met quarterly for the last 4 years, every 3 months. Membership on that committee includes 3 members of the City and Borough of Sitka, the City Administrator, and currently Dave Miller and Amy Ainsley. It includes 3 members from the Sitka Community Hospital Board, or designated for former members of the Sitka Community Hospital Board. That includes Mary Ann Hall and Dr. David Lamb. It includes 2 members from Sitka Tribe of Alaska, Mr. Frank Olson and Rachel Moreno, and it includes 3 at-large members from Search. Lastly, I'd like to take a moment to thank our staff. So we have a wonderful professional staff who are dedicated to the work that they do, are dedicated to providing care to the people in Sitka. Coming forward here in the next few weeks, many people will be at home enjoying their holidays, and our staff will be working hard to take care of our patients. Many of our staff have been confronted in some very aggressive ways about questions about these services, and in ways that are very depreciating in terms of their commitment, and depreciating in terms of the quality of the care that they provide. Our staff deserve all of our respect and kindness and appreciation, and I want to thank them publicly at this point in time. So, again, thank you for inviting us to provide more information about our home-based care program, and I'm happy to take your questions.
Yeah, thank you. I appreciate your time this evening and coming to, excuse me, to get your side of the story out. I appreciate that because it does sound like you have quite a PR issue on your hands right now. So I look forward to search continuing to get the word out about this continued services and the new existing services, because I think the angst in the community is very high right now, and I think that's on you to try and ease some of that as much as possible. So we appreciate this step in coming here and getting this out, and I hope that it's the first of many around the community. Thank you.
Thank you.
Do you have a question?
Yeah.
Okay. Yeah, please, Julia.
Thank you for coming. This is very informative and helpful, and a great way to get out to the people in the room and people listening at home. I had a question about, your new program is called Home-Based Care. And you have here in your new approach slide, your dedicated staff that's clinic-based. So how can it be home-based and clinic-based at the same time?
Thank you for the question. So what it means is that it's processed. The care is being processed through the clinic environment rather than through a freestanding home health agency. So we have outpatient clinics, like one of them is in the hospital, it's called OPD. Another one is Sitka Medical Center. And those clinics have staff, and those staff support these activities for skilled nursing. So the nurse case managers, the social workers, the people that counsel people about their financial support, etc., are all based within those clinics. With regards to rehabilitation services, those services are headquartered out of our Mountainside Rehabilitation Clinic. So that's
So people don't have to go to the clinic?
no, they don't.
So anyone that requests that is certified homebound can
Yes.
get services in their house?
Actually, they don't have to be certified
Certified as homebound.
as homebound anymore. So as Mr. Spivey was mentioning, what we've been able to do with this program is extend care into the home environment for anybody who needs it. They don't have to go through a certification process, and our staff can, at the request of the patient's physician, or if they simply call and need some service, we're able to go to their home and provide that.
And what's the wait time on that?